South Korea has reported 34 new COVID-19 cases, the third day in a row its new infections tally has been below 40. The new cases included 21 local infections according to the Korea Centers for Disease Control and Prevention.
All but 4 of the locally transmitted cases were reported in Seoul and Gyeonggi province that surrounds the capital, where up to half of the country's population lives.
South Korea has been one of the most successful countries in fighting the coronavirus pandemic, but recent clusters around the capital have caused concern, and a 2-week period of toughened prevention measures in Seoul have been extended indefinitely, Yonhap reports.
The Chinese state media tabloid The Global Times says the 27 new cases in the capital, Beijing, today takes the total in the past 5 days to 106, as per the graph below.
At least 29 local communities in Beijing are under lockdown as a result of the new cluster.
The Global Times also says that after the cluster of infections found in a Beijing market, Wuhan, where the virus outbreak began, started a 3-day inspection of its supermarkets, wet markets and vegetable markets on Saturday. In a tweet, the Global Times said all 6,178 samples took sick from those markets, including chopping boards, kitchen knives, tested negative for #coronavirus.
An estimated 1.7 billion people, more than 20% of the world's population, risk becoming severely infected with COVID-19 due to underlying health problems such as obesity and heart disease, according to analysis carried out by the London School of Hygiene and Tropical Medicine and published in the Lancet Medical Journal.
The study analyzed global datasets of illnesses including diabetes, lung disease and HIV. Used these to estimate how many people are at heightened risk of serious COVID-19 infection. It found that 1 in 5 people have at least one underlying health problem, putting them in greater danger.
While not all of those would go on to develop severe symptoms if infected, the researchers said around 4% of the global population, or around 350 million, would likely get sick enough to require hospital treatment.
As countries move out of lockdown, governments are looking for ways to protect the most vulnerable from a virus that is still circulating, said Andrew Clark, who contributed to the study.
This might involve advising people with underlying conditions to adopt social distancing measures appropriate to their level of risk.
Clark said the findings could help governments make decisions on who receives a COVID-19 vaccine first when one becomes available.
The study found that less than 5% of people aged under 20 have an underlying risk factor, compared with 2/3 of over 70s. Countries with younger populations have fewer people with at least one underlying condition, but risks vary globally, according to the analysis.
In these extraordinary times, The Guardian's editorial independence has never been more important. Because no one sets our agenda, or edits our editor, we can keep delivering quality, trustworthy, fact-checked journalism each and every day. Free from commercial or political bias, we can report fearlessly on world events and challenge those in power.
Your support protects The Guardian's independence. We believe every one of us deserves equal access to accurate news and calm explanation. No matter how unpredictable the future feels, we will remain with you, delivering high-quality news so we can all make critical decisions about our lives, health and security, based on fact, not fiction. Support The Guardian from as little as $1 and it only takes a minute. Thank you. Charlotte Graham Maclay. New Zealand has broken a 24-day streak of no new cases of COVID-19 in the country, recording 2 new infections from returning overseas travelers. Both of the new cases, which are related, have been diagnosed as a result of recent travel from the UK, health officials have just announced. More details will be given at a news conference in 2 hours. New Zealand's government reported that it was free of COVID-19 last week after the last remaining sufferer from the virus recovered. However, the country's top health official said at the time that there would inevitably be more cases as new arrivals entered the country. New Zealanders, their families, and particular essential workers, are the only people currently permitted to enter the country. They must stay in government-run quarantine for 2 weeks, during which time they will be tested twice for the virus. The country has recorded less than 1,500 confirmed cases of COVID-19, and 22 deaths, after a strict and early national lockdown. China has reported 27 new domestically transmitted coronavirus cases in Beijing, where a fresh cluster linked to a wholesale food market has sparked WHO concern and prompted a huge trace and test program.
The new cases bring the number of infections confirmed in the Chinese capital over the last 5 days to 106, amid new lockdowns across more than 20 communities in the city.
The National Health Commission also reported 4 new local infections in Hebei province, which surrounds Beijing, plus another in southwestern Sichuan province.
In total 40 new cases were reported across China on Tuesday, of which just 8 were imported.
Earlier we reported that the WHO said the cluster in the capital was a cause for concern.
A cluster like this is a concern and it needs to be investigated and controlled, and that is exactly what the Chinese authorities are doing, WHO Emergencies Director Mike Ryan said.
The Reuters news agency is reporting that U.S. Secretary of State Mike Pompeo plans to meet a Chinese delegation in Hawaii this week to discuss bilateral ties that have soured deeply since the start of the year.
The world's top 2 economies have been at loggerheads in recent months over the handling of the coronavirus pandemic and China's move to impose new security legislation on Hong Kong and of course their ongoing trade dispute.
Hong Kong's South China Morning Post newspaper cited an unidentified source as saying that Yang Jiechi, a state councillor and member of the Communist Party's powerful Politburo, will lead the Chinese side in the meeting with Pompeo.
The U.S. State Department and White House did not respond to requests for comment about the trip, first reported by Politico on Friday.
The United States and China will each allow 4 weekly flights between the two countries, the U.S. Transportation Department said on Monday, easing a standoff on travel restrictions in the midst of the novel coronavirus pandemic.
Following the Chinese government approval, Delta Air Lines said it would resume passenger flights to Shanghai from Seattle next week via Seoul, and once-weekly flights from Seattle and Detroit beginning in July.
In a statement, the Transportation Department said it will continue to press for the full restoration of passenger air travel between the United States and China, in part to allow for the repatriation of Chinese students who have been unable to fly home because of the shortage of flights.
As the Chinese government allows more flights by U.S. carriers, we will reciprocate, it said.
Mexico has recorded more than 150,000 coronavirus cases, according to the health ministry, after 3,427 new infections and 439 fatalities were added to their tally on Monday.
There are now a total 150,264 confirmed coronavirus cases and 17,580 deaths, though the government has said the real number of infected people is likely significantly higher than the official count.
Just on the U.S. Food and Drug Administration revoking its emergency authorization for hydroxychloroquine to treat COVID-19, President Trump appeared to criticize the move.
I took it and I felt good about taking it. I don't know if it had an impact, but it certainly didn't hurt me, Reuters news agency reported Trump as saying on Monday.
It added that the president said there had been great reports out of France, Spain and other places, without offering any evidence or further explanation. France is one of the countries that has already stopped using the drug for COVID-19 patients.
U.S. regulators have revoked the emergency authorization for malaria drugs championed by Donald Trump for treating COVID-19, amid growing evidence they don't work and could cause serious side effects.
The Food and Drug Administration (FDA) said on Monday the drugs hydroxychloroquine and chloroquine were unlikely to be effective in treating the coronavirus. Citing reports of heart complications, the agency said the drugs' unproven benefits do not outweigh the known and potential risks.
In a separate announcement, the FDA also warned doctors against prescribing the drugs in combination with remdesivir, the lone drug currently shown to help patients with COVID-19. The agency said the anti-malaria drugs could reduce the effectiveness of remdesivir, which the FDA cleared for emergency use in May.
Hydroxychloroquine and chloroquine are frequently prescribed for lupus and rheumatoid arthritis.
The FDA granted emergency use for the anti-malaria drugs in late March. At the same time, the U.S. government accepted 30 doses of hydroxychloroquine and chloroquine that had been donated by 2 foreign drug manufacturers. Millions of those doses were shipped to U.S. hospitals to treat patients who weren't enrolled in clinical trials.
Dr. Stephen Nissen, a Cleveland Clinic researcher who has been a frequent FDA advisor, said he would not have granted emergency access in the first place.
There has never been any high-quality evidence suggesting that hydroxychloroquine is effective for treating or preventing coronavirus infection, he said, but there was evidence of serious side effects.
You can read our full story below.
All indoor sports and entertainment venues were shut down in China's capital on Monday as authorities raced to contain a coronavirus outbreak linked to a wholesale food market, with some neighborhoods placed under complete lockdown.
Tens of thousands of people were also targeted in a massive test and trace program, as the World Health Organization reported that more than 100 cases had been confirmed so far.
More than 100 cases have now been confirmed, WHO Director General Tedros Adhanom Ghebreyesus told a virtual press conference, adding that the origin of the cluster linked to the Zinfati market was still unclear.
A cluster like this is a concern and it needs to be investigated and controlled, and that is exactly what the Chinese authorities are doing, WHO Emergencies Director Mike Ryan said.
Authorities have locked down 21 housing estates near Zinfati in the south of the city and another market, Yuquandong, in the capital's northwestern Haidian district, where cases linked to the Zinfati cluster have been detected.
Officials said they were in the process of testing more than 90,000 people living in the locked-down communities for the virus. They said 200,000 people had visited the Zinfati market since the 30th of May, and they were trying to trace and test all of them, including going door to door.
More than 8,000 workers from the market have been tested and sent to centralized quarantine facilities.
Let's go first to the rising number of infections and predictions out of Washington University that U.S. infections could pass 200,000 by October. The forecast projects 201,129 deaths due to COVID-19 by October, mainly due to the reopening measures underway, the Institute for Health Metrics and Evaluation (IHME) at the University of Washington said on Monday.
The IHME raised its estimate by 18% from 169,890 and said Florida would be among the hardest hit states, with an estimated 18,675 deaths, up 186% from a previous estimate of 6,559 on 10 June.
The institute raised its estimate for deaths in California by 72% to 15,155 from 8,812 and increased its outlook for Arizona by 56% to 7,415 fatalities from 4,762.
Forgive me if I baffle you with numbers for a moment, but predictions over U.S. deaths has been somewhat of a roller coaster during this pandemic. If you cast your mind back to March, and the top U.S. coronavirus task force advisors, Drs. Deborah Birx and Anthony Fauci, estimated 100,000 to 240,000 Americans could die from the virus. They made their grim prediction at a White House briefing, calling it our real number, while also pledging to do everything to reduce it.
Then, when strong restrictions came into force, the estimates seemed to seriously drop, to closer to 60,000 deaths. But when President Trump effectively stopped his daily White House briefings, after his suggestion of injecting disinfectant, he began hinting that the toll may end up being higher, perhaps 80,000 to 90,000, in a virtual town hall, with Fox News. Now things seem to have come full circle with this estimate of perhaps 200,000 deaths by October.
Hello and welcome to The Guardian's live coverage of the coronavirus pandemic, with me, Allison Rourke.
We kick off today as global infections pass 8 million cases. The U.S. has a quarter of those cases, 2.1 million. A new forecast by the University of Washington has estimated there may be 201,000 deaths due to COVID-19 in the United States by the beginning of October, mainly due to reopening measures underway. Currently, the death toll there stands at over 116,000.
Brazil, meanwhile, the other major world hotspot, is nearing 900,000 cases and has more than 44,000 deaths as of on Monday, according to Health Ministry data.
The rising numbers come as the World Health Organization said that Beijing's new cluster of more than 100 infections is a cause for concern. The city has ramped up testing and reintroduced restrictions in some areas because of the new cluster of cases in the capital linked to a wholesale food market. All indoor sports and entertainment venues in Beijing were shut down on Monday as authorities raced to contain the outbreak.
Here's a summary of the other main news so far.